Hello everyone. In this video, I'm going to talk about Alfuzosin. Alfuzosin is one of the medications that is classified as an alpha-1 blocker. This medication is indicated for the treatment of benign prostatic hyperplasia. Alfuzosin can affect your heart. It may impair your attention, or it can even reduce your blood pressure. It can also produce a prolonged erection. All such effects of alfuzosin are very essential to know before using this medication. In this video, we will discuss such important facts about this medication. How it works. Benign prostatic hyperplasia is a condition with an enlarged prostate that may develop in a few symptoms like frequent need to urinate, increased urination at night, and sensation of incomplete emptying of the bladder. You may also have trouble urinating with a weak stream of urine. Alfuzosin can act as an alpha-1 blocker. It can relax the muscles in the prostate and bladder. This improves the urinary flow and reduces symptoms of BPH. How to take this medication. Alfuzosin is available as an extended-release oral tablet at a strength of 10 milligrams. For the treatment of benign prostatic hyperplasia, it is given at a dose of 10 milligrams every day, taken after the same meal. Never take alfuzosin on an empty stomach. It is suggested to be taken with food at the same meal each day. Preferably, it can be taken with dinner every day. Do not crush, chew, or split the tablets, as they are specially coated. This coating provides a gradual release of the medication throughout the day, and this sustained release may be lost when you break or chew the tablet. Hypotension. Alfuzosin can alter your alertness or even coordination of the movements. It also produces some dizziness and postural hypotension. It may reduce your blood pressure, particularly when you change your posture, and it may also produce some dizziness and fainting. With the first few doses, you can observe some syncope. Therefore, you should be cautious during the early days of the treatment. This dizziness can be further increased by intake of alcohol. That's why consumption of alcohol should be limited while taking alfuzosin. You should also avoid a few medications that can lower your blood pressure. Medications like prazosin, doxazosin, and terazosin belong to the same category of alpha-1 blockers. They may be used to control hypertension. However, due to the similarity of their target, a combination of these drugs with alfuzosin can induce a significant lowering of your blood pressure. A few medications like sildenafil, tadalafil, avanafil, or vardenafil are used for the treatment of erectile dysfunction. All these medications are phosphodiesterase type 5 inhibitors. These PDE5 inhibitors can produce vasodilation and can increase hypotension when given with alfuzosin. Prolonged erection. Use of alfuzosin may produce one of the conditions called priapism. This condition is associated with prolonged erection and may also involve a few symptoms like tenderness, painful erection, erection unrelated to the sexual arousal, chest pain, and a prolonged erection lasting for more than 4 hours. In such conditions, use of the alfuzosin should be immediately discontinued, as it may cause damage to the erectile tissue. Effects on heart. If you found any abnormal heartbeats, trouble breathing, pain in your back, jaw, throat, or arm, or unexpected sweating, stomach upset, dizziness, and vomiting, it may indicate a risk of heart attack with the use of alfuzosin. In such conditions, again, this medication should be discontinued. Alfuzosin can modify your heart rhythm. In a few people, it may prolong the QT interval, which may result in fatal cardiac arrhythmias. Therefore, if you have any previous history of longer QT intervals or any heart disorder that causes the rhythm changes, you should use this medication very carefully. Testing for prostate cancer. In a few people, prostate enlargement may be observed along with prostate cancer. Therefore, it is very essential to assess whether you are having any prostate cancer before treating with alfuzosin. Alfuzosin is not useful to reduce the growth of prostate cancer, and it can even mask the symptoms of this condition. Therefore, before use of alfuzosin, you should check for any existence of prostate cancer. Taking with grapefruit. Alfuzosin is significantly metabolized by the CYP3A4 enzyme in the liver. This metabolism can be reduced by grapefruit juice. Grapefruit contains a few chemicals called furanocoumarins. These components are able to block the metabolism of alfuzosin in your liver by blocking the activity of CYP3A4. This may increase the levels of alfuzosin in the body, leading to significant dizziness and lightheadedness. Therefore, avoid taking large amounts of grapefruit juice or eating grapefruit while taking alfuzosin. Allergic reactions. In a few people, alfuzosin may produce a few of the allergic reactions, resulting in the trouble breathing, swelling of the face, lips, mouth, tongue, or throat. It can also produce skin rashes and itching. In the development of such symptoms, this medication should be avoided. Side effects. It mainly produces dizziness and headache. Constipation, abdominal pain, and indigestion are common. Other side effects like impotence, bronchitis, back pain, pharyngitis, and upper respiratory tract infections can also be observed in a few people. It can increase the chest pain and even worsen the symptoms of angina. Alfuzosin may cause a sudden drop in your blood pressure when you're standing from a seated or lying position. These are the most important things that you should know before using alfuzosin. Thank you for watching this video. Please share your experiences in the comments section below. If you enjoyed this video, please don't forget to subscribe and hit the like button. Have a lovely day, take care, and goodbye.